presentation addresses the Patient Protection and Affordable Care Act, otherwise known as ACA. It also addresses how it has impacted healthcare access, cost, and quality. ACA was signed into law on March 23, 2010 by President Barack Obama. Before the signing of the ACA, there were many uninsured due to the inability to afford healthcare plans, as well as some were deterred due to their uncovered pre-existing conditions. The intent of implementing the law was to reduce costs, expand access to care, and improve the overall standard of care delivery. A fundamental change was the introduction of regulated health insurance exchange markets, or otherwise called marketplaces, which offer financial assistance for ACA-compliant coverage to those without traditional insurance sources. One huge component of the ACA was the mandate to be covered. In turn, there was a tax penalty if one could not show proof of coverage. This penalty increased over the years, starting in 2014 through 2016. It consisted of the greater of $695 per year, up to a maximum of 3 times that amount, or $2,085 per family, or 2.5% of the household income. The ACA increased the eligibility for Medicaid services to adults with incomes up to 133% of the federal poverty level. In addition, the ACA included provisions to streamline eligibility, enrollment, and renewal processes, for example, by requiring a single application for Medicaid.
Since the enactment of the Affordable Care Act, many Americans have gained access to better health care through the Medicaid expansion. As shown in the diagram, many states have adopted the Medicaid expansion. As of August 2023, 38 states, including Washington, D.C., have adopted the Medicaid expansion under the ACA, leaving only 12 states who are yet to adopt this expansion. The ACA's prohibition on denying coverage and charging higher premiums based on pre-existing condition has allowed many individuals with pre-existing condition to gain access to health insurance. Overall, the ACA has significantly expanded health insurance coverage and access to health care for millions of previously uninsured or underinsured individuals. Challenges, however, remain, such as the coverage gap in states that have not adopted Medicaid expansion and ongoing efforts to repeal and modify the law.
How have health insurance premiums been affected? Before the ACA, health insurance companies were able to increase the premium rate as high as they wanted and deny customers with pre-existing healthcare issues. Individuals and employers were paying a high cost for insurance for little to no coverage. According to the Kaiser Family Foundation, average family premiums for employer-sponsored health insurance increased by 55% between 2008 and 2018, while wages increased only by 26% and inflation rose by 17% during the same period. Average employee premium contributions for single and family plans consumed nearly 7% of U.S. median income in 2017. Since the ACA, health insurance companies must explain the reason for increasing premiums to customers and get approval from the states before enforcing the increased premiums. The individual insurance market, which includes plans purchased through the marketplaces, experiences most significant fluctuations. After the implementation of the ACA, some markets saw double-digit premium increases, particularly in 2017 and 2018. To mitigate premium increases, many employers and individuals have shifted towards high deductible health plans, which is PDHPS. These plans typically have lower premiums but higher out-of-pocket costs for consumers.
The ACA established American health benefit exchanges through which individuals can purchase coverage with premium and cost-sharing credits available to individuals and families with income between 133 to 400% of the federal poverty level. The poverty level is $19,530 for a family of 3 in 2013. In addition, they created separate exchanges through which small businesses can purchase coverage. Since 2020, there is a trend of growing numbers of states choosing to operate their own exchanges with their own enrollment platforms, leaving healthcare.gov, which is the platform. States operating their own exchanges provide states with added flexibility, control, and maybe less costly. Each state implemented exchanges differently and has its own individual official marketplace. Healthcare.gov is a federal platform for healthcare exchanges and is commonly referred to as a marketplace. As of 2024, there are 19 states with state-run health insurance marketplaces, or SPMs, which are responsible for individual market functions. And 3 states use state-based marketplaces with the federal platform, or SBMFP, and again rely on the healthcare.gov website for eligibility and enrollment. Additionally, 23 states have federally run marketplaces, or FFMs, and 6 state federal partnership marketplaces, which are a type of FFM. FFMs involve HHS performing all marketplace functions and consumers applying for and enrolling in coverage through healthcare.gov.
What variables are in play in a political debate over the impact of ACA on cost, access, and quality of care? Critics argue that the ACA has increased federal and state spending due to expanded Medicaid programs and subsidies provided to help individuals afford insurance premiums. Additionally, there is a debate over whether the ACA has effectively controlled insurance premiums and out-of-pocket costs for consumers. Access to healthcare has significantly improved under the ACA. Millions of previously uninsured Americans gaining coverage. However, access disparities persist, particularly in states that chose not to expand Medicaid. The ACA's creation of health insurance marketplaces has facilitated greater access to insurance, yet challenges remain. The ACA has mandated the inclusion of essential health benefits in insurance plans, promoting comprehensive coverage that includes preventive services. This focus on preventive care is intended to improve health outcomes and reduce long-term health care costs. Quality improvement programs such as the Hospital Readmission Reduction Program have been introduced to enhance care standards.
Now, let's look at some of the key challenges facing states and national policymakers given the current ACA status. Policymakers are increasingly recognizing the significant impact of social determinants of health, such as socio-economic status, education, and environmental factors on individuals and population health. They must address issues like provider shortages, geographic disparities in healthcare access, and the integration of telehealth services to ensure that individuals can receive the care they need. Despite the ACA's protections for individuals with pre-existing conditions. There are ongoing legal and political challenges to these provisions. Policymakers must work to ensure that these crucial protections remain in place and are not undermined. In addition, enhancing the collection, analysis, and dissemination of healthcare data can help identify areas for improvement and guide the development of effective policies. These policymakers at both the state and national level are grappling with issues such as stabilizing the ACA marketplaces, addressing affordability concerns, improving access to care, and maintaining protections for pre-existing conditions. Addressing these challenges will require collaborative efforts and innovative solutions to ensure that the progress made under the ACA continues to benefit those who have gained coverage.
On balance, has the ACA been a good or bad law? The Affordable Care Act was enacted in 2010. It represented the most sweeping endeavor to reform healthcare since the launch of Medicare and Medicaid in 1965. Since the enactment of the ACA, there has been controversy and opposition. This law has been good, quote unquote, as it has expanded healthcare coverage to more Americans, which has increased improved access to care and greater use of healthcare services. There were 48.6 million Americans in 2010 that were uninsured. The ACA has improved affordability and lowered out-of-pocket costs for enrolled recipients. The ACA also had important provisions such as prevention of exclusion of insurance coverage based on pre-existing health conditions, and required certain preventative services to be covered at 100%. There have been some quote-unquote bad parts of the ACA, one being the initial mandate that made everyone purchase a health care plan, which has been considered an overreach by federal government. The tax penalty for not obtaining insurance was repealed in 2017. Another concern with the ACA is the uncertainty with repeated attempts to repeal, replace, or overturn key provisions of the law, which can potentially disrupt the U.S. health system. Since the 2016 presidential election, there have been multiple changes to the Patient Protection and Affordable Care Act. This presentation reviewed what the changes are and how they have impacted healthcare access, cost, and quality. The ACA was a law passed in 2010 by President Obama. Prior to this, many Americans were unable to afford healthcare coverage. This law is a major step at moving towards the new paradigm for care delivery, moving towards well-being rather than just healthcare. The ACA created regulated health insurance exchange markets and offered subsidies for individuals without traditional insurance sources. Since 2020, a growing number of states have chosen to operate their own enrollment platforms, leaving the federal platform healthcare.gov. There was a mandate to have insurance coverage and a tax penalty for those who could not show proof of coverage. During the Trump administration, the individual mandate for insurance coverage and tax penalty were repealed in 2019. With the passage of the ACA, there has been an expansion of Medicaid adopted by 38 states. The ACA also increased the eligibility for Medicaid coverage and placed provisions regarding the Medicaid enrollment process. There are challenges facing state and national policymakers given the current state of the U.S. healthcare system. These include addressing social determinants of health, improving access to care, maintaining protections for pre-existing conditions, enhancing data collection and evaluation, addressing affordability concerns, stabilizing the ACA marketplaces, and bridging the Medicaid coverage gap. Healthcare insurance premiums have been affected by the ACA. Prior to the ACA, individuals with pre-existing conditions were denied coverage or charged higher premiums. Since the enactment of the ACA, insurance companies must explain their reason for increasing premiums and obtain approval from the state. We are still awaiting the long-term impacts of the COVID pandemic on premiums such as delayed non-essential care. There is a political debate over the impact of the ACA. Partisan viewpoints have influenced how the ACA is perceived and how different aspects of the law are addressed. Some critics argue that the ACA has increased federal and state spending due to the expanded subsidies and the Medicaid programs. There have been failed attempts by Republicans to overturn the ACA since the 2016 presidential elections. Democrats have promoted the ACA's role in expanding access to care and improving health outcomes. This project has reviewed the bad and good aspects of the ACA. With a large number of uninsured Americans, 48.6 million, the ACA has improved access to care and greater use of services. There is uncertainty for potential disruption in the healthcare system with the continued attempts to repeal, replace, or overturn key provisions of the ACA.